So, are you in the correct session? This is the assessment deep dive for Foundations of Acute Oncology Level 6. Okay, coming in. I can see you've got a notebook and pen there. That's great because you're going to need it to take some notes. Okay, so this module has got two elements of assessment. You need to pass both elements to be successful in this module. So you need to achieve a mark of 40% or more in both elements. But don't worry, I'm going to go into that in more detail now. Let's have a look at element 1 to start off with then. So element 1 is an online closed book exam. It's 45 minutes long. What do we mean by closed book? So this means you should have no notes, no books or web pages or supportive resources allowed or around you at all. So, it's all got to come from your own brain. The assessment requirements itself is that you need a laptop or a PC, so you won't be able to take this on a mobile device or tablet. Now, there is a mock exam available for you on Moodle, and that will also allow you to see if your laptop or PC is compatible with taking an exam on Moodle. But most of them are. Very rarely do we not able to do that. But you can test that out in advance. You're going to need a quiet space where you're not going to be disturbed for that 45 minutes. And you will need some photographic ID. Now that can be your Trust ID card, your passport, your driving license, anything that's got your picture and your name on it. Because we're going to need to check that before you enter the exam. We're also going to need to check your area, your desk area, walls, etc. from where you're taking the exam. So you are going to need to either have a webcam that you can move, or if you've taken out a laptop, for example, that you can move around the room so that we can see your working space. Remember the date and time of the exam. Make sure that you've got that time off and you're available to sit the exam at that date and time. Otherwise, it will be a non-submission. And arrive 10 minutes early so that you can settle yourself and that we can do your ID checks. Obviously, you're going to need to do some revision towards your exam. And you are going to be looking at learning outcomes 2 and 3. So the questions that you'll be asked within your exam are going to be related to these two outcomes. So the principles of the acute oncology service and the acute oncology referral guidelines and the assessment and management of acute oncological emergencies. So you know that those are the elements that are going to be you're going to be questioned on, and those are the bits that you need to read around and revise. Now, we're not expecting you to support your answers with references per se, but what you might want to do and you might find helpful is to support it with your local and regional and the national guidelines where appropriate. The second element then is a 15-minute pre-recorded PowerPoint presentation. We'll be looking at Learning Outcome 1 and Learning Outcome 4. But don't worry, we'll go through those. I'm going to break those down in a little bit. So the assessment unit for this, you are going to be looking at explaining the local and regional AOS and its role within the acute care pathway and the proposal of an AOS review and development plan. So you need to use a critical approach and you need to link the theory to practice. Check out the videos on the playlist on how to record a PowerPoint presentation. It's a lot easier than you think, and as I say, you'll find these playlists on Moodle. You will need to include an introduction slide at the beginning and end with a conclusion slide. Don't overcrowd your slide with loads of text and pictures and things. It really should be your key highlight points that will be an aid memoir for yourself and also for your audience. After your conclusion, you'll need a couple of slides where you'll include your reference list, and you'll be using the Harvard referencing technique system to compile that reference list. Please do not use patient information sources to support academic work. And you should also be citing references throughout your slide deck. So within your slides, we will be expecting you to see citations that support specific points on your slide. So for example, if I was trying to support this point here with a piece of evidence, I would actually put it in the bracket there, Smith 2023, for example, straight after the point that it supports. Don't be tempted to just list all your supporting citations at the bottom of your slide, or the side of your slide. You need to indicate which citation supports which narrative point on your slide. Don't add any music or any pictures that are non-related. Don't overcomplicate things for yourself. Make it nice and simple and clear for your audience. We're not marking you on the prettiness of your presentation. We're marking you on your knowledge, understanding, and application to practice. Okay, so let's have a look at the first part of your presentation, Learning Outcome 1, and I've split these up into 2 subparts. So let's have a look at that first subpart. So you're looking at the local and regional acute oncology services. So you need to explain and almost illustrate this to your audience. So what's the regional area demographic like? How big is it? What types of patients do they look after? What trusts are incorporated within that regional area demographic? And then moving slightly further down into the smaller local area demographic, again, how big is it and what type of patients? And you might want to say how the local area fits within the regional area. So, for example, does your local area demographic, is that actually 50% of the regional area? So it's a big local area, or is it a smaller local area? And finally, you need to explain your local AOS service, so you really effectively. So what facilities are available? What services do you offer? So think about this as boxes within boxes. So how does this box fit within this box that fits within this box? So the jigsaw piece, you're the jigsaw piece, and how do you fit into the bigger picture? And don't forget to support with references throughout. So the second subpart of Learning Outcome 1 is the role within the acute care pathway. So first of all, you need to explain the acute care pathway. So you need to demonstrate your knowledge and understanding of what the acute care pathway is. And then you need to apply this to your local and regional AOS. How do those two, the local and the regional AOS services, feed into that acute care pathway? And why is this so important? So, you need to explore how that acute care pathway fits in with the local and the regional AOS. And don't forget, support with references. Let's look at Learning Outcome 4, so the second part of your presentation. What you need to do to start off with is to review your local acute oncology service, which hopefully you'll have done previously in the first part of your presentation. And coming from that sort of critique and exploration and discussion, you will have identified one area for improvement. One area for improvement. Only pick one. You won't have enough time to do it in 15 minutes if you pick more than one. And if you pick something massive and huge, don't change the world, not in 15 minutes. So pick something very small, very simple, and very clear. Sometimes the small changes are the most effective. And, we're not expecting you to be running before you can walk. So as I said, you will have considered your local service. You hopefully will be using national policies and regional work streams to help you identify an area of improvement, and that it's based on evidence. So again, I'm putting this completely out of the air. So you may have reviewed your local, your regional, national stuff and actually identified and evidence reference research, etc., and identified something in the management of, say, spinal cord compression that actually you don't do within your area, or you don't do particularly well, and actually you want to improve on that so that it's aligned with evidence-based practice and policy. So why is that development important for starters, and how can this be developed? And this is where you want to be devising a development template and populating this. There's loads of templates available, and I think you'll have some available on Moodle And you want to populate this template in terms of how you are going to facilitate this development. So you can't just say, I'm going to bring in this. You need to do that step by step. This is how we're going to bring in this development. And this is why it's so important. Don't keep your audience guessing and think, I think that he or she may be wanting to develop this. Make it obvious and make it simple. So explicit and clear is what I would suggest. And just one. Small is much better than big that will fail. So don't forget to support with references as well throughout that. Finally, a couple of pointers from your tutors. So for element 1, the exam. Read the exam questions carefully. Don't answer the question you think they are asking. Ask the question they are asking. So if you're asked to explain something, explain it. If you're asked to analyse something, analyse it. Element 2, book a tutorial for guidance. Now the minimum expectation is 1 tutorial meeting with your tutor. There is no maximum. So if you need support, contact your tutor. We'd highly recommend that you have tutorial guidance. You can also use the opportunity to send draft work for feedback to your tutor. Now this will probably be in the form of a sandbox on Moodle, but this, watch out listen out to your tutors who will tell you the most appropriate way to reach out and submit draft work for feedback. Tutors cannot see all of your work. They can only actually see 10% of your work. So you're talking about 2 or 3 slides. They won't listen to your narrative, they'll literally look at your slides. So if there's anything you particularly need help with, or you're a bit stuck on this, or you're not sure you're on the right lines, send that slide or a couple of slides to your tutor, however they tell you to do that, to gain some feedback. And most of all, enjoy and good luck.